Well, hello everyone, and welcome to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And tonight I have a special friend, Dawn. She does so much in the community. She is just absolutely amazing. Her name is Lorena Bowles. Lorena, say hello.
Hello. Thank you for having me.
Oh, thank you for taking the time out your busy schedule. So, why don't you tell the audience a little bit about who you are, and then we'll get into, who you work with.
Okay. My name is Lorena Bowles. I'm the Chief Marketing Officer for Trinity Home and Healthcare. And I started with them back in February of this year. And we are a skilled home health agency. So, of course, we do, physical therapy, occupational, speech, skilled nursing, wound care, those type of things. But we do it in the home, which is really nice. And this company allows me to service anyone in the Metroplex in the DFW area that is looking for services in the home. Maybe they don't want to go into a skilled nursing facility for rehab or even, let's say, wound care. And we can provide those services in the home, of course, with a physician order.
I think that is amazing. So it's the way you just explained it, because um, we work with it every day. So people are surprised to know that there's a difference between home care and home health
Yes.
companies. So
Yes.
let's talk a little bit about that so we can help, elaborate and educate people. So your company that you work for has to have a physician's order.
Yes, so that's what makes it very confusing for anyone who's looking for our type of service because they'll go on Google or wherever that they might want to look for these services and they might type in, let's say, home care. Well, that is a broad term.
Yes.
And so it could mean personal care services. It could mean skilled services that, like the services that we provide in the home, that require a physician order, where personal care services don't, that doesn't require a prescription. So, understanding first what the needs are and then being able to assess the patient or the family situation and then making the determination of what exactly the services are that they are looking for.
Right, absolutely. So that's a great explanation, because I get this question all the time. I need a nurse to come
Yeah,
in and be with my parent. It's like, ooh, that's a whole different ball game. That's private duty nursing, which is extremely
correct.
expensive and
And
it's
I didn't even
very,
get into
very,
that.
yeah.
That's a whole separate service.
Yes, it's a whole separate service. Well, this is great. So why did you choose Trinity Home and Healthcare?
Well, I actually stumbled upon this agency by accident. I knew the owner a year prior to. And you know me, Deidre, I love to connect and network with all kinds of people. And even if they are in the same industry, I love to know who the owners are and what they bring to the table, simply because I am not a one stop shop and I cannot provide services for everyone, whether it's insurance or maybe they need a little bit more specialty type services that we can't provide in the home. I love to network with other people so I can see what other services they provide that I can't, and perhaps I can refer back to them. And so when I decided to leave the previous company that I was at, I didn't even know what I was really going to do. So I just kind of sat still for about 3 months and prayed about it. And here I am.
Yeah, and what's so amazing about our healthcare world is, to me, that's what it's about. That's what I love what you do with your networking events. You are amazing. So let's talk a little bit about what you do for the community
Okay.
itself with your networking events.
So I started a group back in 2008 before Facebook was really savvy when it comes to networking. And, if you've heard of the chamber networks, it's very similar to that, but it's a different spin. This group that I started in 2008 basically consists of healthcare providers. And so by bringing together all of these different type of services that everyone is looking for. It's a good way for all of us to better serve our industry and the community. And so I just kind of bring everyone together, and it started with one group, and now there's 10 chapters. And there's possibly one in the works in Colorado. So I'm pretty excited about it. You're the first to know
Awesome.
that.
Oh, yes. Oh, that's awesome. Because I want to say I started networking in 2012 with these networking groups, and
That's
I
how
met.
we met.
Yes, yes. And what I want to say about it is that it's so different from regular networking events. You come into a culture of people who want to help one another and help the client, because all services don't fit all. So I love what you said. You have some wonderful services at Trinity Home and Health Care. But what if you run into that client that it just doesn't match up? So what is wrong with us as a human being saying, okay, I know XYZ home health company, they may better be able to serve you. To
Correct.
me, that's like not leaving the client out in the cold. It burns my, you know what, when people look for a service and then, oh, well, that company said they couldn't help me.
Right.
Okay, who can? You know,
Right.
and that company is scared to refer to somebody because why? I mean, I'm not
No,
understanding.
I come from a yes, I can help you attitude. If I know I can help regardless of whether I provide the services through our agency or through something else.
Yeah.
A perfect example was one of our patients actually who was needing a sleep study, but she needs it in the home.
Mm,
And that is a very challenging service to find, but I was able to find
yes.
someone to do that.
See? And it's by people you know, right? Because
Correct.
we get on the phone. I know you and I have done it before. Hey, do you know who does X,
Yes.
Y, Z? Trying to help the client. You know,
Yes.
that's what it's about. And that is your core, Lorena. I mean,
Mhm.
from the first time I met you, we used to work at a certain company together.
Yes.
And when I met you then, you were so that person that wants to serve.
Yes.
So I know anybody that you work for, I know that's a good company.
Oh, you're sweet to say that.
No,
Thank
I'm telling the truth because you vetted them. So, you know, I tell people that, and I don't want to sound cocky or
you.
whatever, but you have to vet these companies that you work for. What is
Yes.
their core values? What is their culture? How are they treating people? How are they treating their employees? And I know that you, for a fact, would not work for someone that did people like that, because it reflects your culture within, reflects on your clients outside. So
Yes, absolutely.
you are one that I know, like, and trust. So let's talk some more about Trinity Home and
Okay.
Healthcare. So what areas do you guys serve?
Well, as a brand new agency, we just started, like I said, last year. I came on board in February, and we service DFW, of course, and most of like Dallas, Capel, Plano, those areas up there, and as far north as almost to Denton, but not quite.
Okay.
And we do service Johnson County, and of course, and Weatherford. So
Wow.
we've got a pretty significant little territory, and our whole what I want to make sure is that we don't set up our nurses for failure. So we try to service from within and branch out. And, like I said, we can't be for everyone, but for those that we do serve, we do our very, very best to
Yeah.
take care of them and their families.
And that's what I tell people, even when they're looking for a home health company, because lots of times I'm helping my clients and their physician, because the physician provide an order, and
Yes.
9 times out of 10, the physician really doesn't know the core culture of that company unless he's part of it. But that's another story.
Yes. That is
But
another
you know
story.
what happens when you have been referred to a home health company and they're just not following through with what they're wanting to do. To me, that's a disservice. So I love being able to know people like you that I can say, okay, you know what? I know you're going to be taken care of because I know Lorena, and wherever Lorena lies or stands, she's trustworthy.
We do have a really good team, and the culture that we have here at this agency is amazing. Everyone pitches in. There's not a no, that's not my job
Mm.
description, which I totally love. And the owner comes from a place of yes. I have seen her take so many charity patients
Yeah.
that being a small agency, that's very expensive to do. Very expensive, especially someone who has wound care, and needs those type
Oh,
of services.
yes. Oh my goodness.
Because most of the time, insurances don't cover the supplies for the wound care. And so as an agency, you're having to, bite the bullet for that to take care of the patient. And so I love that she has a huge heart and really comes from a place of being able to serve and help.
Yes. So let's talk about how a client would be onboarded. Not sometimes it's the specialist, but most of the time it's your primary care physician. So I'm gonna let you take that wheel and just kind of
Okay.
describe to the audience of how someone will be onboarded.
So a lot of our referrals come from, believe it or not, other families, patients and their families. The Google reviews that we get, the emails that we get from families are amazing. I love getting those. So we do get self referrals. We also get referrals like what you said through primary care physicians, specialists, but a lot of our referrals come from hospitals, rehabs, skilled nursing facilities, someone who, let's say broke a hip or a knee, had a knee replacement, and they're coming out of a skilled nursing facility where
Mhm.
they've had maybe 7 to 20 days of rehab to get them back to a baseline. And then they get referred home with services to continue on at home, such as a therapy, maybe have a nurse there to kind of oversee and manage the medications and things. And so, we'll take care of them at home.
Yeah.
And of course, with the guidance of their primary care.
So if somebody were to self-referral,
Mhm.
what would they need to do?
The first thing they need to do is I gather all the information. So I try to make it as seamless as possible. I kind of research when did they last see their primary care doctor? What is the situation? I had a situation today, matter of fact, where someone was actually left the hospital on their own without getting all of those services taken care of. So, of course, when you leave a hospital and then now it's been a week, the hospital's not going to turn around and send you that referral.
Mm-mm.
So now we're really got to do some digging. So I will do that for them as a courtesy. I will contact their primary care doctor or that specialist, depending on the situation, and try to get that referral directly from the physician, and then make sure that they've followed up with their primary care so that we can continue services and such. But it's pretty easy. It sounds a little complicated, and it can be, but that's what we're here for.
That's awesome. I think that is just taking someone by the hand and just helping them go through the process step by step because
Yes.
you're already stressed out because
Yes.
you're sick or you're worried about your loved one's health or their
Yes.
future care. And it's like,
Running out of prescriptions,
oh,
everything. And if
yes,
you've had any type of surgery or anything like that, you're going to be in some amount of pain. And so we have to make sure that we can get those things together for the family and the patient.
absolutely. Absolutely. Well, I thank you so much for your time. So
Thank you
tell
for having
people,
me.
oh, girl, of course. So tell people what is the best way or ways that they can reach out to you and find out more about the amazing things that you do and also about the things you do for and with Trinity Home and Healthcare.
So you can reach us directly through our office number, which is 817-500-4567. Super easy to remember. Or you can reach out through my personal cell number, which you can attach to this if you'd like. And I don't mind anyone having my information. It's totally out there, and they can call me directly. So not a problem at all.
And you'd also mentioned Google.
Yes.
Yeah.
Yes.
Yeah.
Google is a great way. You can see our reviews on there too, because those don't lie.
That's right. That's right. Well, Lorena, thank you so much for all you do, not only for Trinity Home and Healthcare, but for the community as well, because you provide so much connections and resources between us healthcare providers. And thank you for what you do for the community as well.
Well, I should say the same to you. Healthcare Among Friends is an amazing platform. And so I really, really appreciate you doing what you do as well.
No, thank you. Thank you. And thank you, everyone, for tuning in to Health Chats Among Friends, where we bring you reputable resources from our local communities. Tune in next week because we got another amazing guest and another amazing resource. Thank you, Lorena.
You're welcome. Have a blessed night.
You too.